Hello friends, my name is Dr. Gaurav Agrawal. I am a pediatric and fetal cardiologist working at Delhi. Today I will discuss an important test known as fetal echo test that we do in pregnancy cases. This test is ideally done between 18 to 24 weeks of gestation, and it should be done especially by a pediatric cardiologist because they are well used to see the fetal and pediatric heart diseases in detail. For conducting this test, what are the requirements? There is no special requirement needed for conducting this test. Main requirement is to have a doctor prescription mentioning the fetal echo along with the stamp of that doctor, and one address proof is required. How much time this test will take? Ideally, when it is done by a pediatric cardiologist, this test is generally completed in 3 to 5 minutes duration, and it depends on the fetal position, mother body mass index, and amniotic fluid liquor, etc. Ideally, this test should be done in every pregnancy because label to ultrasound detects 40% of the pediatric heart diseases, and fetal echo can detect up to 90 to 95% of the fetal and pediatric heart diseases. But it should be done at least in high risk pregnancies. What is the meaning of high risk pregnancies? When the maternal age is more than 35 years of age, and the IVF pregnancy is there, twin pregnancy is there, mother is diabetic, and then in these conditions the test should be done 100%. But it has also been seen that when we are not conducting in no risk pregnancies, we are still finding the fetal heart diseases. So that's why I told you in the beginning that it should be done in every pregnancy, and ideally should be done by a pediatric cardiologist. Is there any requirement of empty stomach or full bladder? No, there is no requirement of empty stomach, and there is no need to keep bladder full or empty. Suppose if there is some problem found on the fetal echo test, what can we do? Depending on the condition of the fetal heart, we can discuss the place of delivery, mode of delivery, and the further outcomes of the test. Few cardiac problems are major. In that case, we have to do some type of test known as amniocentesis to rule out some genetic issues. In other forms, we generally don't advise amniocentesis or NIPT test. For more detail, you can log into my website childrenheartcare.com and fetalechoindelhi.com. Thank you very much.